This week's podcast is going to be a little bit different. I talk on the fitness side of things about getting off the elevator at the right floor, but on the rehab side of things, we also have to find out what we need to do with the person when we have them leave our services, when they're out of pain, when they have their primary dysfunction taken care of. We always tell them to go exercise, but we give them no starting point for doing so. On the fitness side, a lot of people just roll into an exercise program without really making sure that they can even do the moves correctly or make sure that there's no underlying problems under the surface. We see all the time, check with your physician first, but the physician really isn't the best person for dealing with the movement side of things. They're good from a physiological internist side of things, but as far as being able to do the movements, understand the movements and what you should be doing, they're not the best place to go. The best people to go to are a sports-minded PT, sports-minded chiropractor, a good personal trainer who's going to actually do a real intake and get you into the fitness at the right floor. I always say, get off the elevator at the right floor. Well, today, what we're going to go over is I'm going to show you a functional movement screen that I put somebody through recently. We're going to break down some pieces of it, more layman's terms. Instead of the high medical terms, I want the general population to be able to understand and digest this pretty well. So I want to focus this more towards you, the general population, and show you why it's important to screen first and get off the elevator at the right floor. Podcast is going to be a little bit longer today, a lot more video content. So if you're listening to this in the background, you want to make sure that you're kind of watching the video as well so you can get the most out of this. We'll be back after the intro. We'll go over what the functional movement screen is, why you should be doing it, and then we'll go over some video as to some parts of the functional movement screen and some of the findings. Don't go anywhere. Defending mediocrity in our profession. Welcome back from the intro. This is the Dr. Krol PT and Fitness Podcast. I am your host, Dr. Lee Krol, physical therapist. And today, what we're talking about, this is going to encompass both podcasts for the week. It's going to be a little bit longer one, a little bit more detail. But I want to focus this more towards the client side of things. If you're looking to get into better shape, if you're looking to start an activity or an exercise program, you always hear you should consult your physician first. It's good advice. The physicians, they're going to make sure that you're healthy, that your internal organs are working the way they're supposed to, that your body is physiologically safe to stack activity and exercise on top of. Where they're outside of their expertise, per se, is when you're talking about how well a person should move, what exercises they should be doing, what activity they should be doing. They're really outside their expertise at that one. Where we come in as physical therapists and personal trainers, yoga instructors, Pilates instructors, is we will set the entry point for you. We will find out where you should be starting, what you should be doing to start out, what we need to correct and fix, and identify any other orthopedic, neurological landmines that you may be stepping into by starting an exercise program. The last thing you want to do is burn your initial motivation to start exercising by developing a hip issue or a knee issue 3 to 4 weeks into your exercise program that you're really starting to enjoy. So what you really should be starting with an exercise program after you get the physician clearance is then some sort of a screening process. That screening process will just make sure that there are no issues on the horizon. There's no issues that we have to find. I personally use the functional movement screen. It's not perfect. There's flaws with it, just like there's flaws with every system and every method. But it still does attempt to answer the question of, are you safe to exercise? Do we have any landmines that we have to avoid? Do we have any things that we can correct? Do you have to go see someone for medical treatment? You know, maybe you're not in acute pain, but we still have a medical issue on the horizon that we should clean up prior to exercise, prior to activity. And What movements do we have to make better? What movements can we really go to town on and work on loading and fatiguing? So that's what a screen is for. A screen is just meant to catch things. We're not looking for pain, we're not hoping we find pain, but if it's there, we want to take care of it. We want to step into it now and clean it up instead of you lunging and squatting and jumping your way into a hip issue or a knee issue or a shoulder issue. So the screen is meant to do exactly that. It is not an assessment. It just tells us what we have to look at. An assessment is when we try to break down the problem and find out what's really going on. So for the trainers that may be listening to this, you don't want to turn this screen into an assessment. It's hard not to. You're going to see things and you're going to be like, oh, I can fix that, I can correct that, or we just make this modification here. Don't do that. Go through the entire screen, get all of the data, and then you'll have a much clearer picture as to what you can work on with your client. From a medical side of things, I really use this as a discharge. I use this as a discharge out into the world of exercise and activity. When my people are done with their treatment for pain, treatment for dysfunction, whatever their chief complaint is, once I've got that cleaned up, this is what I like to do. I like to go into a functional movement screen to find out what else is going on, if anything, what exercises we need to clean up, what things we need to avoid, what things we need to work on. That's what I really use the functional movement screen for on the medical side of things from the physical therapy point. When I have people coming in for training who just want to work on training, just want to work on either being a better athlete, getting into better shape, whatever, this is my entry point to that. I go through the functional movement screen to find out what we need to correct. If there's any medical issues, I thankfully can clean them up with the medical license, or if we're good to go. I'm hoping that we're good to go on everything, but if not, I want the roadmap. So for a client point of view, you want to come in with someone who's going to take the time to put you through the movement screen, one, to make sure there's no problems, and two, to find out what needs to be done, where you need to go. I've always said that if your trainer or your therapist is not screening you on intake for exercise, then they're just guessing as to what you need. They're just pulling it out of midair. They're just kind of doing a mild little look through at you, or they're only good at powerlifting, or they only have yoga in their toolbox, and that's what they're going to throw on top of you, regardless of what your presentation is. So you really want to go through the screen. You really want to have someone look at you at the onset and intermittently throughout while you're working with them, maybe every year, every 6 months, whatever it is, to make sure that, one, you're not getting worse. That's always a good thing, making sure the training's effective. And two, that any issues that you did have, you have a baseline to check against to see if they're cleared up. So a couple of weeks ago, I put someone through a functional movement screen, and what we're going to do is we're going to overlay some video here, and I'm going to sort of walk through this video with you and see exactly what I see here, why we're looking at these things, and then go from there. So the first movement that we look at on the screen is the overhead deep squat. The overhead deep squat's a challenging movement, and when we do the screens, we break it down into one of 4 categories. Again, a screen is just breaking down into 4 categories. Category number 1 is painful. The movement caused some sort of pain that's reproducible, noticeable. The second one is dysfunctional. Dysfunctional doesn't mean you're a bad person. All dysfunctional means is that your risk of getting injured if you keep doing a like type position or a like movement is going to go up. If you load it, if you fatigue it, you don't do the movement well enough to own that type of fatigue and load, so that you're more likely to get injured in some way, shape, or form. The next category is functional. Functional is really kind of my target for most people. Functional, all that means is that you're above the cut. You do the movement well enough. It's not perfect, doesn't need to be perfect. I don't chase perfection in most cases. I'm just looking for good enough. Finally, you have optimal. What optimal means is that you do the move about as well as you can do the move. So I really care about optimal more for the people that I know are competing in something, the people that I know they're going to do a jiu-jitsu tournament, they're going to run a marathon. I'm looking more for optimal in those people. But for the most part, I'm just chasing functional. I'm not looking for optimal. I want there to be no pain, and I want the movements to be functional and symmetrical. I don't want you to be a lot better on your left than you are on your right. So one of those 4 categories. But when I do the screen, I don't know why you're in any of these 4 categories. I don't know that information yet. I'm not trying to assess it. I'm just putting you into a category. It's a screen, not an assessment. And what you'll notice about these movements is they're a lot harder, and they're not quite like how you would see your exercises in a gym. And that's the way it's supposed to be. These movements are kind of a stress test. They're much more difficult and a little bit more challenging than what you would see normally. Like when I show you the overhead deep squat, you wouldn't practice this under load in a gym. You just wouldn't do that. But I look at it this way on a screening side of things, because I want to challenge your body at a high level quickly to see if any problems get unearthed. So if you ever watch a show like Bar Rescue or Restaurant Impossible, they'll put the bar through a stress test. They'll put the restaurant through a stress test, knowing they're going to fail, but they want to see where they fail. They're making it incredibly difficult for the staff there to uncover the problems quickly. Where do we have our problems? Are they times in the kitchen getting the food out? Is they have information to the kitchen? Do we not get the food out quickly because of runners? Do we not have good management? Is it all of the above? That's why they stress test. The same thing with the functional movement screen. I want to put you through a stress test to see if any problems get unearthed. Do you have pain doing this movement? Even you may not have pain doing your squats normally when you practice them at the gym, but when there's a stress test, you have pain, and that tells me that there's an underlying issue in the squat. So we're going to look at Laura's overhead deep squat. So I do a little demonstration to start, and then we go through here. She's going to start in the very first position, which is where I'm looking for optimal. Her feet are flat. They're about hip width apart. They should be pretty parallel. I'll give her a correction. And then I'm going to have her squat down as far as she can go. Now, I can see how she's squatting, but I don't know if it's painful, so I have to ask her, does anything hurt? I give her 3 attempts to do it, unless there's a very particular reason I don't think she can do 3 attempts. What I'm looking for is the bar to stay completely over her head. You can only see it from the front view here. You don't see a side view, but she's not able to keep her spine vertical, so I'm going to make it easier for her by having her step onto the board. So her heels are going to be up, her toes are going to be down. This takes your ankle dorsiflexion out of the equation, but it really shifts you forward and gives your body a lot more permission to sit back into the squat. So we'll see her do it here. Have her push the bar overhead, have her squat down. She does much better here. Her thighs break parallel. She's able to get down, keep the bar overhead, able to breathe throughout it, and it doesn't hurt. So for this one, Laura would be at a functional, which would be, according to their scoring system, which I don't like, they use numbers of a 2. So that would be functional for her, which is great. The next one I look at is the hurdle step. I actually kind of do these out of order. I actually do the inline lunge first, but according to the way they do things, they have the hurdle step. So the hurdle step, we're just looking at a single leg pattern now here. So before I was looking at feet in line. Next, I'm looking at one leg, and after that, I'm going to look at legs in a staggered position. So what I always do is I always try to demonstrate it as best I can, and then I'm going to have her go through it so she gets all set up. She can look down at the rope, and I'm going to have her step over on one side and just tap her foot down. Now again, things I'm looking for is, 1, she loses her balance. If she loses her balance repeatedly and can't do it, then it's dysfunctional. This didn't hurt her any doing this. She's not able to keep everything quite going the same direction when she's standing on the left leg, but it's good enough. It's functional. So we're going to move ahead and say that her left side on this one is functional. And now we're going to go ahead and do the right side, where you'll see her do very similar. Let me get to that point in the video. Good. Now she's over here on the right side, standing on the right side. And again, she's doing reasonably well. It's not perfect, but again, I'm not chasing perfection. But she's not losing her balance. She's not wobbling all over the place. She's able to complete the movement even if it isn't perfect. So the hurdle step, which where I'm looking at a single leg pattern, is good. It's not perfect, but it's not asymmetrical. She's not way better on one side than the other. She's not in any pain. So again, I'm happy with these 2 results so far. And that's just a little piece at the beginning of what we do. We're going to go on to a couple different movements like the inline lunge next. So what I would do is I would demo it and show that you want to keep the bar straight up overhead and go into the position. Now, she has to be able to get into the position. If she can't get into the position at all, then it's dysfunctional. She's not able to maintain her balance or get up onto the board at all. So I'm trying to set her up here, opposite arm, opposite leg, just like if you were running. Try to keep that bar as overhead or as upright as possible, and then she's going to bring her knee right down to the board. So what you can see is that it doesn't stay straight up or down. It's not perfect, but it doesn't stay straight up or down. One thing I can't tell by just looking at her normally is she in any pain? So I have to ask, does anything hurt? So when I ask, she tells me if something hurts or not, and then we move on to the other side. So what we're going to find here is we switch to the other side with the right knee forward, and she goes ahead and does this. And one of the things that you see is, again, she's not able to keep the stick directly up or down, but she does have some pain in the right knee. So even though the movement looks functional, because we have pain underlying, we still knock it down to a painful. Even though she's able to do the movement, it hurts. So we're looking at that point at potentially some sort of medical problem we have to clear up. Do I break her down right at this point and say, okay, we're going to go right into an assessment? No, I always finish the screen unless there's a real reason that I shouldn't. Unless there's a reason health-wise that I shouldn't finish the screen, I'm going to continue on finishing the screen. So next one we're going to do is the shoulder mobility. Now these next two are looking at how well you move grossly through your upper and lower body. It's, again, this isn't all encompassing, but it just gives us a quick little movement. There's a clearing test here, and what a clearing test does is it first just checks to make sure we don't have any major shoulder impingement lying underneath. She was good on that count, so we move on to the shoulder mobility test. And what we're trying to do is see her arms moving at the same time, how close she can bring her hands together with soft fists, meaning she's not squeezing really, really hard. So I'll do a demonstration there, and I'm not wiggling or shaking. I'm just trying to move my arms at the same time. And one of the reasons that we do it at the same time is most athletic movements have an opposite arm, opposite leg type of movement pattern to it, so I want to see how well these move at the same time. I use her hand as a measuring guide and try to get a sense of, okay, this is how close they should be together. And she was better with the right arm overhead than she was the left. It wasn't a massive difference, but one was optimal, one was functional, even though they were only off by about an inch. So it's not majorly asymmetrical, nothing that I would go crazy about. It didn't hurt, so I'm pretty happy with that. You're going to see the left side on here, where she's not as good, but it's still good enough. It's functional. Even though the other side was optimal, by the time she does her third repetition, as you'll see right here in a second, she does that third repetition, she's quite a bit closer than she was on her first one. Nothing hurt on the left side up either. So we're pretty good. Again, asymmetrical by the final categorization. She was optimal with the right arm up, functional with the left arm up, but it was only off by about an inch. So I'm not going to go crazy looking at this one, trying to really, really fix it unless we start to see problems someplace else in a different part of the screen. All right, next one we're on to is the active straight leg raise. So what she's going to do, and for camera purposes here, I'm on the far side the entire time. When I'm looking at her right leg, I would actually get on the other side. But again, I didn't want to block the camera view. Really what we're checking here, there's a lot of things going on, but I want to see how her legs are working together in mobility. So I'm not just looking at the leg that's going up, I'm also watching the leg that's on the bottom. If she turns her foot out or makes some sort of modification to that leg, there's some softness in that knee on the bottom leg, I'm going to stop the measure at that point as well. So what you can see is on this first one, right away, her knee goes soft. She's not able to keep the raising leg straight. I like to give a little bit of cue just to make sure that she understands exactly what I want her to do. I don't want to have that type of error where she doesn't understand what I'm looking for because I haven't explained it well. But I don't want to over cue, and I don't want to coach her too much. I want to see how she approaches it, with just that information that I've given her. So with the left side, she wasn't able to lift it up straight at the height that I'm looking for, So what I'm seeing there is a dysfunction in just gross lower body mobility. And I don't know what it is yet. I don't know what type of problem it is. It could be a core problem, it could be a hip problem, it could be a spinal problem. It's incredibly rare that it's a hamstring issue. I think I've seen maybe 2 truly short hamstrings in my entire career. It's not a hamstring issue overwhelmingly, but I don't know that yet. I haven't broken it down. Having her lift the right leg here, again, I would be on the other side, but for camera purposes, I'm doing it this way. And you can still see the same problems. The knee goes soft right away. She's not able to keep it straight the whole time. So what we're running into here is we're running into a symmetrical dysfunction in gross lower body mobility. Now, I don't know, again, what type of mobility issue this is. This could be a motor control issue where she's just not recruiting well enough. This should be a core issue. It could be a soft tissue problem in the spine or in the hip or in the muscle and tendon itself. I don't know yet. That would be what an assessment would be for. This is just a screen. All this is telling me is, okay, now I have something I have to look into. Now I have something that's going to be, okay, this is a pathway I want to go down, and this is going to lead me to, okay, I probably shouldn't be deadlifting with this person right away until I clean this up. If I start deadlifting with this, I run the risk of compensations and spinal issues, knee issues, ankle issues, anything else going on through there. That's what I run into if I start loading this pattern or fatiguing this pattern. I want to fix it first because that's going to help clean up a lot of lower body issues. How much would cleaning this up improve a squat or a hurdle step or an inline lunge or even the motor control slider that I'll show you in a little bit? We don't know yet, but as a client now we have something to work on. Now we have not a landmine, but we have something to correct, maybe something I would be adding into a warm-up before doing a deadlift or something of the sort. So now we're going to go into the trunk stability push-up. And again, for the clients watching this, you may think I would never do a push-up like this. And no, you wouldn't. You would not practice a push-up like this. This is a stress test. So I'm going to demo where I want her to come up in one unit as best as she can at the highest level position. So I'm looking for optimal right here. Now she's already done the clearing test at this point, meaning we've already cleared out a lower back issue that would just negate this right off the bat. But we want to see what she can do. Now, even if I suspect she can't push herself up from the highest level position, I still want to check that because I want to make sure it's not painful. So from a client standpoint, I want to make sure that you don't have an underlying pain that you're just avoiding by not getting into that position. So she's not able to come up clean from that position, so I'm going to make it a little easier by moving her torso up a little bit. Have her try it again, and you can see the little bit of a break, a little bit of a wave at the lower back right there. And when I asked her, did that hurt? She points right to her lower back. That didn't feel too good. Ask her again, is it still there as she does the reps? And sure enough, it is. So the movement overall is dysfunctional. It's not wildly dysfunctional. It's not a train wreck, but it's dysfunctional. It's not perfect. I'm going to be pretty tight with my criteria here. I don't want to, try to give her extra credit that the body doesn't need. It's not the point. The point is to, if you find something, fix it. But not only was it dysfunctional, it was painful. So she drops into a painful realm on this. So now, already going through the screen, if you're a client, we found a mobility issue, potentially some sort of movement issue in just the gross lower extremity by lifting your leg. We found a little bit of knee pain with doing the lunge pattern, and now we found there's an underlying seemingly low back issue with the trunk stability push-up. I don't know if it's a low back issue. It may not have anything to do with the lower back. It could be a glute issue. It could be a timing issue. It could be a breathing issue where the thoracic spine's locking up. I don't know what the problem is yet. I just know that if you're my client, I now have to look at this. I now have to look at, okay, what's going on here and what do we have to do moving forward? The next one here on the screen is the rotary stability. A lot of people see this more as the bird dog, but there is a higher level position that I'm going to attempt to demo. I can't demo it perfectly, I'm reasonable at it, where you're going to load to one side completely. And really all we're looking to see is the body able to control a rotary type test against it. Again, I've never seen anyone able to do the optimal position really well, but I always look at it in case it hurts. Again, I always want to stress it. She's not too bad, but you can see the foot rolling away from the board. You know, she's not able to do it clean. It's not perfect, so I'm not going to give her an optimal on this one, but the good news is on the optimal position, it doesn't hurt. And that's a good thing. We don't want it to hurt, but if it does, it's something we take care of. Tries on the other side, not able to really do it. Again, the foot rolling away, not able to do it simultaneously, arms and legs. No big deal. So we make it a little easier by going into what would be called the bird dog type position, where she's going to do opposite arm, opposite leg. She goes through like that, opposite arm, opposite leg. They have made some changes to the functional movement screen where they do look at this a little bit differently. It's a little tighter criteria. But this one right here is what I'm going to do. The bird dog, she's able to do this without wobbling, keeping everything in contact with the board. I like this one. So she's functional on both sides and it didn't hurt. But I already have a lot of information to go off of. Now, what I do, because she doesn't have any type of reason that I don't think we can continue on, I'm going to go into the ankle mobility. So if the ankle's not moving the way it's supposed to, that can really screw up everything else up and down the chain. So ankle mobility is really, really important, especially moving in something called dorsiflexion, where you're bringing your toes and your foot up and stretching out the back part of the leg. It's a simplistic way of looking at it, but I'm going to demo it for her, then we'll move on. And what I'm looking for is to see, one, does the ankle move far enough? That's the first thing. Two, is it painful to move your ankle that way? And three, what do you feel? So you can see her heel comes up a bit here on the left, so I give her a little bit of correction, have her come back down. And what I'm looking for is, does she feel a stretch in the back part of the calf, which is what she should be feeling, or does she feel any type of pinch or impingement in the front? And she doesn't feel that, so she looks pretty good here. The knee's going far enough. It's hard because she's got the black pants on. You can't really see it, but she is going past the target point that I'm looking for, so I'm pretty happy with that. She's feeling a stretch in the back of the leg, which is where she should feel it. So again, I'm happy with that on the left side. She'll step over to the right, and we'll do the same thing on that one. And again, we come up with the same result. She looks pretty good in terms of her movement. It's not unbelievable, but it's good enough. She feels a stretch in the back, no pinch in the front. So I don't have to really worry about the ankle. I don't have to guess that the ankle is part of the problem or something I have to work on. I've checked it. I've taken the time at the front end to look at these things for you, the client, so that I don't have to waste your time later going through a bunch of unnecessary corrective warm-ups that I'm just hoping and guessing that they work. The last two things I'm going to do are the motor control screen. And what the motor control screen does is it gives me a little bit of objective data. It gives me some numbers as to how well she's able to post on one leg and do a little bit of work that way. So I'm going to do a little demonstration. And then what I'm going to have her do is step on top of the board and try to push that slider as far as she can without the heel coming up. As soon as the heel comes up, I stop her, I take the measure, and I reset and move on. So not too bad here. Not too bad here. I'm measuring the right leg. That's the one she's standing on. Not too bad. She's doing pretty well with that. Heel comes up a little bit, stop her. But she's able to get to the target point that I'm looking at, which is 2 times her foot length. She's able to do that. And I let her keep going as long as she's improving or not getting worse. So as soon as she starts having an issue, I'll switch her up to the other side. And now we start doing the left leg. Heel comes up a little bit when she does some of these movements, so I stop her. Not a problem. Doesn't hurt. There's no reason I shouldn't be continuing. So we keep going, and what we find is that she's actually pretty symmetrical side to side. She's able to do about the same reach, which was 21 each side, which is good. That's at her target point because her foot length was 10 and a half. I want her to be able to do 21. So what I now have is I now have a baseline set of data that shows me that, one, she's got pretty good control. This isn't a complete mess. So She has pretty good control. I'm able to work with this, and I'm also able to see, okay, did she get worse with any of the correctives I did? So if I do correctives to try to fix things, whether it's the pain that we were finding or it's just the motor control or dysfunction that she was having earlier, one, did I make it worse? And two, did I make it better? These are the things that we're looking for. We don't want to make things worse. And if you're a client, you really should be looking at a trainer that wants to hold themselves to that standard, that wants to set a baseline that says, okay, I'm going to hold myself to this standard. I'm going to make sure with data that we are getting better, that we are moving better, that we're not making you worse, that we're not setting you up for an orthopedic issue. That's one of the reasons why the functional movement screening, or some sort of screening, doesn't have to be the FMS, it can be a lot of different things, but some sort of screening is good. You don't want to guess as to what the person needs. The next one we're going to do, or the last one we're going to do, I should say, is we're going to do the same thing, but instead of posting on the leg, we're going to post on the upper extremity, and we're going to see how well she does on the upper extremity. So I'm going to demo it here, reaching over, about a 45-degree offset from the board. She has to be able to come back to the position, and we'll see how she does on here. Most people are a little bit nervous about this one. They don't like this one so much. They don't think they're going to do pretty well on this. But she's doing reasonably well. She's able to hold her position. She's able to reach. Not twisting and really cranking as much as I would like to see, but she still did a good enough job. That was posting on the right arm. She was able to get to about 20, which is just a hair below what I'm looking for. But what I really want to see is she way better on one side than the other? And as she goes through, what you can see is she's pretty similar on this side. She approaches it about the same way, posting on the right versus the left. So yeah, I'm pretty happy with this. She's just, like I said, a little bit below the cut here, but not bad at all. Doing pretty well on that. It didn't hurt. So even though there were some underlying pain issues, she's able to at least work through and present reasonably well, even with some of those underlying issues. So this is a good thing that she's able to do that. She should just get better over time, and as we take some of these pains away. So what am I looking at here? I put people through a bunch of these tests. I put people through a bunch of these screens. Now what? Now can we start exercising? Now can we start lifting heavy? Now can we start sweating? Sure, she's got a nice presentation here with just a couple of issues that I have to clean up. So now that I have this information, I can start taking a look at what she needs. And what she really needed here was me to take care of some of these pain issues. So the first thing I actually did was that I reassessed the way she did her mobility. So I looked at, can you even do a toe touch? She was able to reach down for her toes really well. So she can't lift her leg up straight, but she can reach her toes down to her toes pretty well, and it didn't hurt. So now what I'm looking at is, okay, do we have an issue here in terms of hamstring mobility, gastroc mobility, which is your calf? Probably not. She's able to reach to her toes, so she probably has enough mobility in the hamstring. So stretching her hamstrings really isn't the issue there. I had her do a doorway lift, where she would sit in the doorway, have her one leg up on the doorway, and then lift the other leg up to meet it. Because I'm looking at more of a control issue here. She's got the mobility, so how about a control issue here? So I had her do that lift. And she was able to do that, and she improved quite nicely on the straight leg raise when I retested it. Then I checked some of the painful patterns. Now that we got some of the mobility off the table, did the trunk stability push-up hurt anymore? And it didn't. So that was a good thing. So we took some of the pain off the table without having to go through a real medical diagnosis. We can just look at it and see if there was still pain on the table, and there wasn't. Also, the pain in her inline lunge cleaned up quite a bit too. So we were able to do some of these things with just a little bit of a mobility drill, well within a personal trainer's scope of practice. They shouldn't be trying to diagnose the pain, but you can retest something and see, did that pain go away? And it did. So she was able to do pretty well with that type of just quick active mobility drill that she was able to do. Is a little bit of a core dysfunction, so that's what I would probably attribute this to, her leg raise being a core dysfunction. I would attribute some of that pain with the trunk stability push-up to a core dysfunction. So we were able to clean that up, and then we load it with a deadlift, single leg deadlift, to try to keep that pattern nice and strong. So what I had her do, she was already training beforehand, doing some sort of lifting. So I said, okay, before you start all this stuff, you need to warm up this pattern. You need to go into this doorway lift and then load it with some deadlifting and then move on, which she's been able to do, and she's been doing pretty well with that. But if we just start throwing her into an exercise routine and just trying to make her work hard so that she felt good sweating and working hard, we probably would have stepped onto a bunch of landmines. And we don't want to do that. As a client, you should be hoping that your trainer is going to take a really good intake look at you, make sure that you don't have these landmines that you're stepping all over, make sure you don't have these movement issues that you're stepping all over. She presented really well, just a couple things that we had to clean up. So that's what we're doing with the functional movement screen. That's what we're doing with the stuff on intake. We want to make sure that you, the client, are in the right spot. So what do you need to do as a client? If you're not in the Western New York area and you can't get in touch with me, you can find someone that does do functional movement screening. You can look up the functional movement screen. You can ask the trainer, the yoga instructor, the Pilates instructor, what do you do to get me on board? What do you do to help me start at the right spot so that I don't have any issues, so that I don't start developing knee or hip pain, or at least the risk of knee or hip pain or shoulder pain or neck pain goes way down. What are you doing to help me start at the right spot? These are really important questions to ask, and these are the things you should be looking for when you're looking to hire a trainer, or yoga instructor, or Pilates instructor. You should be looking for someone who's going to take the time to onboard you and really screen you the right way, and use that information to tailor your program as much as possible. You don't want to try to be going to someone who's going to try to fit the square peg into the round hole. You really want to go through and be screened out well, make sure there's no medical issues, and move on from there. This is Dr. Lee Krol signing off for the Dr. Krol PT and Fitness Podcast. If you made it this far, you know the drill. Like, subscribe, share, put it on social media. Do what you have to do, help this channel grow. Make sure you're finding out about all the information by getting that subscription, getting that ding sent up to your phone so you know when the new podcast is going to air. Again, this is going to be the only one for this week. It's going to be a little bit longer one, more to digest, but I want to give you, the client, something to look at and say, hey, that's something I should be going through. So you can look up functional movement screen and see what that's all about. You can go onto their website, functionalmovement.com, that's currently the website, and look for an FMS trainer in your area, someone who knows this stuff, someone who knows what to do with it, someone who's going to put you through the information, the training and the screening the right way. Always train smart, then you can train hard after that. This is Dr. Krol PT signing off. I will see you next time.